Welcome, Julie. Okay, so I know Julie from church, and she did a talk at church during our fellowship time about the importance of sleep. I feel like it was 2 years ago.
I think so. Yeah. Couple.
Uh-huh. And I said to myself, oh, I'm going to see if she'll come on Sanctuary and do that for us. So that's how I know Julie and her husband and her two boys. Um, anyway, go for it, Julie. Let's hit it.
Okay. Super. All right. So, so I'll go to the next. I'm gonna tell you a little bit about myself, and it's funny, Margie. I know that my boys can be very non-existent at church sometimes now that they're older, but I actually have three boys. So
Great boys.
you'll
That's right.
you'll
I didn't see the older one very often. You're right.
I know exactly. Yeah, he's older. So yeah.
Mhm.
Anyway, okay, so a little bit about so this is what we're going to chat about today. We're going to discuss kind of specifically how it relates to women, and some of the topics they'll include this, sleep hygiene, sleep environment, sleep and immunity, and then obviously some many more topics. And this is so funny. I do not like this picture. I mean, I think it's a good picture of me and my husband. But my one of my twins here in the front, the one with the black shirt, he hates this photo. I'm not a big fan of it. He got stung by a jellyfish right before this, and so he was in a lot of pain. And so, but honestly, I don't know if the background of any of you ladies, but um, once they get older, it is really hard to nail them down for family photos. So this is like the
Yeah.
last family photo I have of all of us. I've got, snippets of, me with the twins. And anyway, so this is it. So I'm a wife and a mother to three kiddos. My oldest is 21, and then the twins are 19. Both of them are starting college, or they just started college this year. The one that got stung by the jellyfish in the front, they're all taller than me now, and he is in Arizona on going to school playing volleyball. And my oldest son is he's a auto mechanic, so he works at a dealership, a car dealership. And I'm a licensed mental health counselor and a certified gentle sleep coach. I mostly work with my coaching practice is mostly with families who have little kids, 0 to 6 years old, who have sleep struggles. And however, I do. Obviously, Margie said I've done sleep talks to adults. I've done them for teenagers, and yeah, so I'm just all about sleep. So today we're going to talk a little bit about why women's sleep matters, why it's important for us women, and basically we're going to discuss we're going to have why women experience sleep challenges. They experience them at higher rates than men, and not because we're doing anything wrong. Our bodies are just biologically more sensitive to these hormonal shifts, stress, and mental loads that we carry. Sleep affects everything: our mood, metabolism, um, and oops, sorry, I lost my notes here. There we go. Sleep affects everything: our mood, metabolism, the immune health, emotional resilience, long-term well-being, and women, when we sleep well, and I heard a couple of you say this before I got on, everything in life feels more manageable. Uh, when we don't, it really impacts every system in our. And sleep, some of you probably are very familiar with our different sleep cycles, how that works. There's a typical pattern for sleep stages, and there can be substantial variation based on a number of different factors. One of them is age. Time in each of these stages, the REM, non-REM stages, can they change dramatically over our life. So when you talk about little newborns, when I work with them, they spend a lot more time in the REM sleep and may enter a REM stage as soon as they fall asleep. As they get older, usually right around age 2 years old, for any of you who have grandkids, that's when their sleep starts to more mimic adults. And older adults, those of us, we tend to spend less time in REM sleep than the average younger ones. And then another factor are recent sleep patterns. So if you're getting irregular, inefficient sleep over a period of days or more, it can cause an abnormal sleep cycle. Another factor is, alcohol or other drugs that they can possibly impair our sleep, alter our kind of our sleep architecture. For example, alcohol decreases REM sleep early in the night, but then as it wears off, there's a REM sleep rebound with prolonged REM stages. And then another factor is sleep disorders. And we'll talk a little bit more about this on another slide, but there's certain things that may affect our sleep, like sleep apnea, restless leg syndrome, and some other conditions that cause multiple night wakings, and they may interrupt with a healthy sleep cycle. Okay, now we're going to talk about the science of healing. So deep sleep is where the body repairs muscles, tissues, immune function. And REM sleep is where the brain processes emotions and memories. And when we're waking frequently or not getting enough total sleep, we lose out on these essential stages. And helps understanding this helps us to see sleep not as just a luxury, but as a biological requirement for healing. So having consistent high quality sleep improves resilience and cognitive clarity. And I'm sure some of you have heard this term, sleep hygiene. Some important things with sleep hygiene for us women is to stick to a sleep schedule. And honestly, that's for anybody. And for the recommended, we want to stick to a regular sleep schedule and set aside about 8 hours for sleep. I know we're not going to, when we lay down and think, oh, I'm going to sleep 8 hours, but you'll probably sleep a lot less because we have those little wakings in between sleep cycles, right? So just try to set aside 8 hours. And then hopefully you'll get at least 7. But the recommended amount of sleep for a healthy adult is at least 7 hours. Most people don't need more than 8 hours in bed to be well rested. Some of us do. Go to bed and get up at the same time every day. I know that's challenging, especially for some people who want to sleep in on the weekends, but having a consistent sleep and wake schedule reinforces your body's circadian rhythm. If you don't want to fall asleep, if you don't fall asleep within about 20 minutes of going to bed, the recommendation is that you get up, leave your bedroom, go do something relaxing, try to keep the lights either dim or off, read or listen to some soothing music, and then go back to bed when you start to feel tired again. And then you're supposed to repeat this as needed, and continue to try to maintain your sleep schedule and wake up time as best possible. And a lot of that is due to people who may have like insomnia. That's kind of the recommendation, is not to spend more than about 20 minutes laying in your bed, so you're not having a negative association. Pay attention to what you eat and drink. So you don't want to go to bed hungry or stuffed. In particular, avoid heavy or large meals within a couple hours of bedtime. Discomfort might keep you up, and nicotine, caffeine, alcohol deserve caution too. The stimulating effects of nicotine and caffeine take hours to wear off, and it can interfere with sleep. And even though alcohol might make you feel sleepy at first, it definitely disrupts sleep later, as we talked about earlier in the sleep cycles. Creating a restful environment, keeping your room cool, dark, and quiet. Doing calming activities before bed, such as taking a bath, using relaxation techniques, might promote better sleep. And this one can be challenging for some people, but trying to limit daytime naps. It's funny, I'm not a very good daytime napper historically, but man, since I've hit the menopause stage, I'm telling you, having a nice nap during the day can kind of get me through those times, those struggly days. So long daytime naps can interfere with our nighttime sleep. So we want to try to limit the naps to no more than 1 hour and try to avoid napping too late in the day. However, if you work nights, you might need to nap late in the day before work to help make make up some of your sleep debt. Um, Including physical activity in your daily routine. And for a lot of us older women, just walking, trying to like have vigorous walking is really helpful. But any regular physical activity can promote better sleep. However, being active too close to bedtime may not be beneficial. It can actually kind of get your body all jazzed up. So trying to not do it too close to bedtime, do it earlier and as early in the day as you possibly can, but definitely try to cap it about maybe 3 hours before bed if possible. And then my favorite one is spending time outside every day might be helpful too. And what they talk about is spending time outside in the morning so you can get the morning light, and then also evening time when the sun's going down. That kind of helps our body's circadian rhythm to really get in a nice flow. It's really beneficial, that those kind of lights. Managing worries. Try to resolve your worries or concerns before bedtime. I like to have a little journal or a pad next to my bed to jot down anything that's on my mind, and try to set those to do things aside for tomorrow. Stress management might help, starting with basics such as getting organized, trying to set priorities, and delegating tasks to others. Meditation can also ease anxiety, and then just know when to contact your healthcare provider um, if you continue to struggle, and to help identify any and treat any underlying causes that can help you get some better sleep. All right, so how stress disrupts women's sleep. So stress is one of the biggest sleep disruptors for women. The mental load of planning, remembering activities, anticipating things, keeps our brains active long after we want to wind down. Cortisol, you've probably heard, sorry, I'm a little behind here. Cortisol, our stress hormone, will delay sleep onset and make our nighttime wakings more likely. Um, we want to make sure that our cortisol is supposed to be highest in the morning when we wake up. And then as the day goes by, it should get less and less. And there is a little peak of cortisol in the afternoon, but then for the most part, the cortisol should go down as the day goes on. And then our melatonin actually starts to rise in the evening. Many women say that their brain turns on the moment they lie down, and that's not a personal flaw, it's a stress response. So the good news, there are gentle ways to interrupt that cycle. Those things are journaling, progressive relaxation, slow breathing. Those are things we can practice before, trying to close our eyes and go to sleep. So when we want to create a healing sleep environment, these are some things that are really important for us. Is a cool, dark room. We talked about that already. Usually the best temperature for sleep is usually somewhere between 65 to 68 degrees. I like my house to be before I go to bed, because I don't know if you can know, maybe I'm just very aware of this, but in the evening time, so our body's temperature starts to slowly drop, and I get like, oh man, I got to turn the temperature down in the house. It's kind of warm in here. And so I usually have my house at about 68 during the day, and I put it down to about 66 at night. I live in Washington State. I know that may be different if you live in warmer areas, but so at night our temperature is down to 66. Some people like it even cooler than that. But having a nice cool environment is really helpful. Dark room. So if you notice that the sun is coming in, like in the summertime, if it's staying really light late or getting light really early, maybe having some blackout shades is really important. And then of course a quiet room is those are all ideal combinations. I like to have a little fan or a white noise machine on in the background that kind of blocks out my teenagers or my older son coming in late at night, the furnace kicking on, creaking of things. I don't like hearing all those. I'm a light sleeper, so it kind of will wake me. So just having something in the background that just have a nice little calm um, fan type noise in the background helps for some people. So think of your bedroom as a sanctuary, a place that your body associates with rest. And then having small changes, like I said, about blackout shades, a fan, removing bright screens. I know some people get really mad at me for saying this. No TV in our rooms can make a big difference. Um, Having a supportive mattress or pillow is important too. And this one, reducing light exposure 1 to 2 hours before bed. So this can be challenging. Some of us are fortunate that we have on our, if you like to read on your phone or your computer, if you have one of those, some of them have the where it changes from blue light to like a dark screen at a certain time of night. You could always get on and schedule that. I have that scheduled on both my computer and my phone, but really trying to get off of blue light screens an hour to 2 hours before bedtime is beneficial. And I already said this, keeping technology out of your sleep space is helpful as well. And then having a gentle wind down ritual or routine will help to signal your nervous system that it's safe and it's time to shift into rest mode. I like to take a shower in the evening and sit down and I read a book, or I read like a chapter of a book. Sometimes I don't even get through the whole chapter, but having these little rituals and routines before bed is really helpful. And this is just a picture I wanted to show you, blackout shades, the temperature here, white noise. And up here on the right side is a picture of a candle. So you don't have to obviously have candles in your room, but they do have certain lights out there that mimic the color of a candle. And if you think about it, that's the kind of the color that you want to have, so that it doesn't interfere with our melatonin production, which is, and this is kind of showing you, so the blue, from the blue sky all the way down to daytime white. And then at night, we want to have closer to this candle on the very left side here, that kind of light color. So dimming, we have dimmers on all of our light switches here at the house, dimming them as the day goes by. And then, in the summertime, if the sun is up really late, maybe starting to close some windows just to kind of start to get the light not so bright in the evening time. Then technology and sleep. So this one is really important because obviously we're wired all the time. Our biological clock in healthy adults follows about a 24-hour sleep-wake cycle. When the sun rises in the morning, your body produces cortisol. We talked about that, a hormone that makes you feel awake and alert. So technically, it's kind of funny. A lot of us get up and we have coffee, but honestly, our body's cortisol should be really like helping us to be awake. And then as daylight fades, the body releases the other hormone, which I mentioned is melatonin, and those should produce feelings of sleepiness. And any electronic backlit devices, like I said, cell phones, tablets, readers, computers, emit short wavelength enriched light, also known as blue light. So fluorescent and LED lights also emit the same blue light, which has been shown to reduce or delay the natural production of melatonin in the evening and decrease feelings of sleepiness. Blue light can also reduce the amount of time that you spend in the slow wave and rapid eye movement, so your REM sleep. Two stages of the sleep cycle that are both vital for cognitive function. And I like this little thing here. We've talked about some of this stuff, but I thought this was a cute little slide that talks about benefits of good sleep. It helps you to, when you get good sleep, reduce the frequency of getting sick. It helps us to maintain a healthy weight, reduce the risk of serious health issues like diabetes, heart disease, lower stress and elevate your mood, sharpen your thought process, enabling you to perform well at work or in the classroom, interact better with others so we're not so irritable, hopefully, and then make wise choices and reduce the risk of injuries. So these are all some wonderful sleep benefits. So sleep and immunity. This was interesting to learn, but vaccinations are often more effective when you're sleeping well. Flu shots actually may be 50% less effective with inadequate sleep. We also, quality of sleep helps us to fight off the common cold. Did you know that less than 7 hours of sleep at night make you about 32% more likely to catch a cold? And defending your health. So, quality of sleep is your immune system's best defense. It can help you become more resistant to and recover fast from many diseases. So, really, sleep is very, very important. So, the two things that are really important for sleep is not only the quantity of sleep, which we'll talk about what a typical quantity of sleep is in the next slide, but also very good quality sleep. And quality of sleep
This is a reminder. Call James at Bill Wonderland of Tech.
someone's unmuted. Improves recovery. So sleep helps us recover fast from exercise, injury, and illness. During the first 4 hours of sleep, 80% of the body's human growth hormone is produced, which is essential to physiological recovery. Additionally, heart rate and blood pressure dip, giving the heart much needed rest. So it's so amazing all the different things that happen to our body while we're sleeping that are so beneficial to us. Having anxiety relief. So during that first part of the night too, which we're mostly in our deep sleep, helps calm our anxious brain. Deep sleep also decreases anxiety overnight by reorganizing our connections in our brain. Mental well-being. So that REM sleep is also essential for a lot of the brain's cognitive and emotional functions. And since most of it happens during the second half of the night, it's important to get 7 to 9 hours of sleep. And finally, increases energy and focus. So physical energy, positive mood, and creativity and memory are also good quality. So this is that sleep averages. It's kind of fun. I like to see all the different changes that go on throughout our lifespan. As you see here, when you're down to a newborn, lots and lots of sleep. They're supposed to sleep a lot. And then as we get older, it starts to dip. Something that's interesting too, I know this says 8 to 10 hours, but I've actually seen some teenagers that need more like 11 to 12 because of all of the changes that are going on hormonally in them. And this is something to note too. As kids are in this teenage years, their circadian rhythm actually shifts forward. So I don't know if any of you noticed this when you were teens, but I remember being so frustrated not being able to fall asleep before like 11 o'clock at night. And it was super frustrating because I had to be at school the next day by 7 a.m. And I was just always like, just exhausted. And it's come to find out, they're finding out now that teenagers, their circadian rhythms are actually shifting forward. And then as all the hormones start to settle in and calm down, then they become more like, at 18-ish is when they start to become more like adults. And as we get older, as you see, having a little bit less sleep is normal. And then of course, for our pregnant mommies, we need 8+ hours of nap sleep because they are also helping to grow a little one or two in my case. Okay, medical sleep problems. So this is some things that may cause you sleep disruptions. The first one is OSA, or obstructive sleep apnea. And this is actually the most common sleep-related breathing disorder. It causes you to repeatedly stop and start breathing while sleeping. There are several types of sleep apnea, but the most common one is OSA. Insomnia is also a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. You may still feel tired when you wake up. Insomnia can sap not only your energy levels and mood, but also your health, work performance, and quality of life. RLS, which stands for restless leg syndrome. It's a condition that causes an uncontrollable urge to move your legs, usually because of an uncomfortable situation. I've had this before when I was kind of sick about 4 years ago, and it feels like little bugs. I don't know if any of you have had that experience, but just crawly, creepy bugs. And it just usually it affects you at the beginning of sleep and then also in the middle, somewhere like around 2 a.m. So restless leg syndrome is very frustrating. So it happens in the evening and then in the night when you're sitting or lying down, moving, kind of moving your legs, eases the unpleasant feelings, but temporarily, unfortunately. And they're starting to possibly see a correlation with this for some people. Between our ferritin, our storage of our iron, so iron levels, if they're kind of in the tank, we might see more restless leg syndrome. So that's something to ponder. Parasomnias. This is an interesting situation where you see some unusual sleep behaviors that can occur before falling asleep, during sleep, or in the transition between sleep cycles. Parasomnias are most common in children: sleepwalking, sleep talking, bedwetting, night terrors, and there's also a really unique one called exploding head syndrome. I like to always share this. This was when I was in my late 20s, and I was working in a drug and alcohol treatment center for teenagers, and they sent me to it's like a conference, and it was a dual diagnosis conference. And they're like, "Oh, do you mind getting a roommate, like someone you don't know?" I'm like, "That's fine. I didn't care. I was young. I didn't care." So I go get this roommate, and this woman, all of a sudden, like, we all go to bed, and we're in down in this area that's not super super great. We're right by the freeway. And in the middle of the night, probably about, gosh, it was probably like 11 or maybe midnight. All of a sudden, I'm woken with her screaming at the top of her lungs, yelling, getting down on the floor, and crawling to the door. And my cortisol just went, whew. And then I realized, I'm like, oh my gosh, she's sleeping. Like, she's having a night terror. And again, usually night terrors are more in the younger kiddos, but this woman was having a night terror, and I could not get back to sleep. And the next day I told her, I was like, do you know that you have night terrors? Oh, I'm sorry. I was like, you think that would have been something nice to share with me? Because it was very, very scary. And so I ended up actually going, and I had some friends that lived nearby, so I just like went and stayed with them because I was like, I can't do that again. I was like up for the next like 3 hours because my body's cortisol just went through the roof. So different kinds of parasomnias affect us all differently. Excessive sleepiness. So it's normal to feel sleepy after a night of sleep loss, but excessive daytime sleepiness is a medical term that describes extreme grogginess occurring almost every day for at least 3 months. EDS, which is excessive daytime sleepiness, makes it difficult or impossible to stay awake during the day. A wide range of medical and psychological conditions can lead to EDS, including, as we mentioned, sleep apnea, narcolepsy, hypothyroidism, chronic pain, depression, and anxiety. They can all help make us feel very sleepy during the day. And then for those of us who may be nurses or doctors or just people with shift type work, can have a disorder that develops because you're working late at night or early in the morning, and then sleeping during the day and working at night can cause a misalignment between your daily schedule and your body's circadian rhythm. And people with this condition often feel excessively tired at work and struggle to get enough sleep during the day, during their daytime rest period. All right, so some gentle strategies for better sleep. So here are some gentle, realistic strategies. One of them is cognitive offloading. Writing down tomorrow's tasks. This is one that I like to do, sitting down before I jump into bed and writing down or looking at my schedule for the day so that I'm not laying in bed ruminating on what's going on. It helps to quiet our mind. Certain relaxation techniques, they can shift your body out of the fight or flight, which obviously we don't want to be in the middle of the night. Consistent routines anchor your nervous system, setting boundaries around screens and work protects your evenings, wind down. Also, if sleep challenges persist, absolutely okay to seek help. As I mentioned, go see a pediatrician. See, I'm used to working with parents, your primary doctor, or even a sleep doctor. And you don't have to navigate these issues alone. Let's see. So I talked about cognitive offloading, so relaxation techniques. I don't know if any of you are familiar with progressive relaxation or guided imagery. I do have an example of a progressive relaxation technique. I was gonna, if we have time, I can do it. Otherwise, I can just send the link to Margie to share with you all. It's a really good one. The thing with those is if you're gonna do them, you want to try to make sure that they're on before bed. You want to make sure that they're on some sort of a automatic turn off thing. Don't just have it going on all night. And it also wouldn't be helpful if you had to get up and turn it off. Let's see. Consistent routines. We talked about setting boundaries around work and screens. Yeah. Okay. So now these are certain books that I have found really helpful for me. The Stanford Sleep book, Why We Sleep, Unlocking the Power of Sleep and Dreams, kind of a really, really interesting one. And then The Brain Rules, I don't know if anyone's heard of this one, has some really wonderful, that one's really fun to read. It's kind of not super dry and boring. And then also, I don't know if any of you have heard of a Happy Light. I have this in my kitchen, especially here in Washington State, where we get what's called the big dark. It's literally gets down to light only about 5 hours during the day. It's very frustrating. So I love having a little Happy Light in my kitchen. I turn it on in the morning and it's on for about 10 or 15 minutes while I'm unloading the dishwasher, getting breakfast ready, getting my coffee ready, etc. You want to obviously do that during the day, not at night. And in summary, so to summarize, we want to choose 1 to 2 habits each week to start. Don't overwhelm yourself with trying to do everything. And then try to have your sleep environment become more friendly if you notice, oh, I need to work on a couple of things. Try to prepare your body for sleep, like I said, with some of these routines and wind downs. Prepare your mind for sleep, like I said, with the journaling or some relaxation techniques. And again, please seek help if continued sleep problems. And then, yeah, this is it. This is me. So as we wrap up, I encourage you to choose one of those habits. I did email Margie a handout that has a lot of the stuff on there. So just remember that small sustainable changes are far more effective than trying to overhaul everything all at once. Celebrate progress, not perfection. Your body is always working towards balance, and sleep is one of the most powerful tools you have for healing. Work on creating your sleep haven, practicing preparing your body and mind for sleep. And remember, if you continue to struggle, like I said, talk to a doctor or a therapist that can help you work through some of these issues or concerns. All right, so we have some time for questions, I think.
Thank you.
You're welcome.
Oh my gosh.
I think I just sent you a note because since I live in Washington, where did you find your Happy Nut Light?
My husband got it for me, I think at Costco. I haven't seen him at Costco recently, but I would guess like Amazon or something. I can do some research and message it to Margie and let you guys know.
Perfect. Because believe me, I get what you're saying about 4:30. It's nighttime.
Yeah.
So that would be extremely helpful. Thank you.
Okay, you bet. Yeah.
Yes. I too have heard of the Happy Lights. We've had some.
I have a question too. I have I have a sleep problem. I have like insomnia, but I also tend to sleep with my TV on. And
Mhm.
I know that's a bad habit, but to me, even though I know it's wrong, I feel like it'll help me go to sleep because I'll tune it out. But I think that in theory, but really just makes me stay up. So I don't know what your thoughts are about TV.
Yeah, yeah, you're right. The recommendation is that it's called what we call a sleep crutch or an association. And if there's any way that you can work on eliminating that, you'll probably find that you'll get better quality sleep. But I
Mhm.
know I've actually, I have a lot of friends that and then they're like, I know, I fall asleep with the TV on. Julie, you think it's terrible. I'm like, no, I mean, I understand why people do it. And a lot of people have done it for years, you know. Yeah, I remember as a teenager, a young adult, I remember watching TV until I got so drowsy. But I did turn it off. Maybe that's something you could try is like watching it till you're drowsy and then
Yeah.
turn it off and see if that's gonna be a good thing. And then you can work on doing less and less. But I know that's a big association for some people. Yeah.
I think I'm gonna work on a timer because my TV has a timer. I don't want to use it because I know it'll work, but I'm gonna use it now. I'm gonna use it.
I love it. Uh,
I
yeah,
see, Maria, you have something else to say?
you're muted, Maria. If you want to maybe type it in if you can't unmute yourself.
Sorry.
Oh,
Here
yes,
we
there
go.
you are.
Uh, my question was this related to Tiffany's, which is I've spent my life leaving the TV on because my brain just ruminates about everything. So I kind of consider the TV kind of white noise. I've recently started to just fall asleep with nothing on, no TV, no nothing, and it's difficult, but I am noticing a difference in how long I sleep,
Oh,
well I sleep. I still have to snatch on the TV or snatch on the iPad. Um, but no, very much so. So I agree. I'm saying when you said timer, I said,
yeah.
oh, what a good idea. Okay, I'm done.
Thanks, Maria. Yeah, it's good to hear that. It's good to hear. Yeah. Yeah.
Um, eye covers. You know those eye covers
Oh, yeah.
that people
Masks.
wear?
Yeah. I
Yeah, the
wear
little
one too.
mask.
Yep. I wear them too.
Ugh,
I take them with me everywhere I go, hotels. Yep.
I do.
Yep.
I take them off in the middle of the night. I don't know. It's a suffocation thing. Like I feel like I'm suffocating
Yeah.
or
Yeah.
something. I wake up like, oh, what's on my face? I'm gonna try. I'm
Yeah.
gonna try
Yeah.
the mask again.
Yeah. Don't worry about it. I mean, if sometimes it's just a matter of getting your body used to it. And if you pull it
Yes.
off, well, I mean, for me, it's weird. Like the pressure is nice. Like I can't sleep without it, which is probably bad. But I like it
Oh,
because it like feels like nice deep pressure on my eyes. And it's
yeah,
funny, like my because I also historically have been a teeth grinder. And so my
yeah,
brother-in-law, who's a dentist, he gave me what do you call them? Well, inserts or whatever. And now like at first when I was wearing them, I was like, ah, it's so hard to sleep with these big things in. And now I find that
yeah,
I can't sleep very well without them because I'm so used to having those in my mouth. And also because it helps to not grind my teeth. That's another
yeah,
sleeping stress
yeah.
issue, anxiety, whatever. So yeah,
Yeah.
Maria,
Okay.
you too. Yep.
Mm,
Very cool.
jeez.
I wanted to
Um,
suggest, whoops,
what causes paralysis?
what?
Oh,
Hmm.
Yolanda, I'm sorry, Yolanda also
Yes.
Yeah.
has her hand up.
I just checking. I don't have a problem going to sleep, but I cannot stay asleep. Any recommendations?
so there could be a few different reasons for that. I would have you spoken with your primary doctor about that?
Yes, and we really couldn't come up with anything. And
Mm.
then she gave me the lowest dose of like a muscle relaxer, but it didn't do anything.
Yeah, you almost
Mm,
would. I would love for you to like maybe reach out to maybe a sleep therapist or a sleep doctor, because it might be due to, because certain things may cause that, just rumination, like anxiety. It could be depression. It could be our hormones. I know for me, um, when I take progesterone now, with all the menopause stuff, and that helps me to actually get through and not wake up in the middle of the night. I was definitely waking. Lots of changes in our hormones for women as we get older. That can cause some of that too. But I would definitely don't I'm not a huge fan of just throwing medication at somebody when you don't, like I'd love for maybe your hormones to be checked out, or speak to a therapist, a sleep therapist, about, maybe your sleep hygiene, maybe something easy to fix there that might help that. Maybe timing of bed, who knows? Yeah. Lots different.
Thank you. Mm-hmm.
Yeah. Did you say someone was asking about paralysis or something? Is that what you were saying?
Yeah. Someone in the chat, was it? Oh, it's Carol Ann.
Yeah, she asked what causes sleep
Yeah, what
paralysis.
causes sleep paralysis?
Yeah. Yeah.
I'm like pronouncing it wrong.
Yeah. Sleep paralysis. Very
Yeah.
interesting. So that is one of those. Do you guys remember when I was talking about those parasomnias? I told you that gal did the night terror. So sleep paralysis is usually because we're in our REM sleep, our dream sleep, and we when we go into our dream sleep, our body produces a hormone that basically paralyzes us, so that we can't act out our dreams, right? And so what happens, what's happening is you're waking in that dream state, and you feel paralyzed. But it's because that hormone is still in your body. And so it's just this weird state. And I've never, well, maybe that's not true. I have experienced it very minimally a few times, where I just feel like I can't move. But it's because I'm waking up. I've had some friends that they feel, oh, I had a demon on me. Like there's some really scary like stuff out there. But scientifically, it's because we're waking in that dream state, where our body is has that hormone that paralyzes our body. And there are certain people too that actually don't produce that hormone, and they act out their dreams, and that's when it's dangerous for them to be in bed with their spouse. Very interesting sleep stuff. So
Good to
Maria,
know.
do you have another question?
Um,
Let's see.
I've been learning. I've noticed a lot of women wear glasses in our group and amongst just society. One of the things I've been researching is eye pain, because I've had eye pain, and it especially got worse through chemo.
Mm.
And cataracts tend to grow much more quickly through chemo. And that obviously, the pain affected my sleep. I recently purchased what is called cornea care, and they're heated eye patches. And I bought 3 boxes, 3 months worth. And within one use, my eyes, the pain I've been suffering for about 15 years went away. And I've been researching the glands within the eyelids on the top and bottom, and the fact that after a while our glands become clogged. Yep. And that natural oil process that lubricates our eyes goes away. So I want to suggest to other people that are having problems sleeping, perhaps use that, because I've heard a lot of women talk about dry eye and all these different things, hormones changing, and I swear to you that you can throw them out if you want or give them to someone else. But I would check out cornea care, because it gives you a consistent warm heat. And you can go to sleep with them on. So I guess it's not a question, but more of a, hey, did you hear about cornea care and the different products you can use to soothe your eyes? Because I have gotten better sleep since I started using them.
Oh, that's wonderful.
And there's
Thank you.
Oh, and there's other products like that, but that was the first big time, quick to the point, no gadgets, just a mask. So I thought,
Oh,
I,
stores
yeah,
carry it. Okay.
it's
Okay.
called
I'm gonna try
Corny.
that and the cherry juice. I've heard about the tart cherry, but I feel like I don't drink it. I didn't drink it at night. I was drinking it during the day. And but yeah, I'm gonna try that one and the eye things. One question too, what about a Kindle? You know, like I don't have a Kindle, but the blue light from the Kindle, does that stop you from sleeping as well?
So those also I think have like a setting that you can it'll give you a different blacker screen, or it'll have a they all should have. I mean, nowadays I think all computers, all phones, all readers have a, if you go into the setting, there should be like a nighttime setting.
Okay.
As long as the back of it is black, it should be fine. But I was going to mention, because we were talking about, I guess I should have added a slide about food that's good for sleep. That I've heard tart cherry stuff too. Whether or not that works, but things like, well, they say bananas, which I question only because it's got a higher sugar content, but oranges, pineapple, tart cherry. Milk, warm milk. I don't like milk, but warm milk in the evening also is helpful for sleep, supposedly. Just try to reduce. There's a rule. It's like 3-2-1. So like 3 hours before bed, stop any alcohol. 2 hours before bed, stop eating. 1 hour before bed, stop drinking, like water and stuff. So
anything. Okay.
we're not up a million times going to eat.
So, okay. I see LaFonda has her hand up. Or is that a hand, LaFonda?
Hi.
Oh, yeah.
Thank you for your presentation, Julie.
Oh,
I noticed I have a lot of the things that you named on the list. I have hypothyroidism, and that I guess led me into my sleep apnea, and that was really bad. So they put me on a CPAP machine, and I also struggle with insomnia a lot too. And my doctor, they suggested I take melatonin, but the hypothyroidism and the sleep apnea actually contribute to me getting congestive heart failure. So you really have to be on top of those conditions because it can affect other parts of your body. So sleep is really important because I've struggled with my sleep for years.
Absolutely. Yeah, thanks for sharing that. And one thing that's interesting about melatonin is melatonin, those medications. So obviously they're not, the FDA doesn't monitor them. So we don't really know how much is in those melatonin pills unless you get like a prescription grade, and that should be correct. But melatonin, it only helps with the onset of sleep. It really doesn't help with any wakings in the middle of the night. However, I have seen for both myself and for some of my families that I work with little ones, that when their pediatrician gives them melatonin, it's very interesting because I think when it affects the onset of sleep, in the first half of the night, I was telling you guys, that's when we have our deep sleep. I think when we start to get really good deep sleep, I think that will benefit the rest of the night. Unless you have some other medical issues that might be disrupting that. So melatonin, if they're like, oh, I wake up in the middle of the night, oh, here's some melatonin. Well, I would be hesitant because that's not really going to help middle of the night wakings necessarily. It's more so for the onset of sleep. However, like I said, on occasion, I have seen it help later sleep too, because I believe it really does benefit our deep sleep. So melatonin's interesting. I mean,
okay. Mickey? I see Mickey's hand up. Oh, maybe it's not supposed to be. Oh, you're on mute, Mickey.
Okay, I'm sorry.
That's okay.
I was just saying that my doctor, when I was going through the chemo and everything, she suggested that I try ZQL. And that works really well for me to give me a sleep and give me a sleep. And then I also like if something goes on or if the phone rings in the middle of the night, I wake up without the drowsy, without the hangover feeling. It doesn't give me any of that, but it does give me a good sleep. And then I also found this headband that has Bluetooth and it hooks up to your phone. And so I listen to piano music, I listen to soft music, I listen to sleep to scriptures, and I let that play. And usually they have like an 8 hour one, and I just let that play all night, and I get a good deep sleep because I also suffer with insomnia. Um, and some nights I can't sleep, but once I put that on, I could put them headphones on and I am like out of there. That music is going, or either that the Sleep with Scriptures has music with it, and it's somebody that has a melatonin voice, and he's just talking the scriptures, and there's music playing, and puts me to sleep, puts me in a
Okay,
good
send it
sleep.
to us.
And so this headband is
We
flat,
want
so
it.
it's almost like not having anything on. It's just like having a headband on, only it has the speakers right on your ears, and then you can push the up and down button, and so that works perfectly for me.
Mickey, what was the first thing you said you
I've
took?
seen those. I just
The
never tried them.
ZQL.
I'm
ZQL.
The
sorry.
ZQL is like
Oh,
the
and
NyQuil, but it's from NyQuil, but it's ZQL, and
yeah.
it has no
Oh, deep.
addictive, and it doesn't, like when I wake up, if Jackie calls me at 2 to change or anything, I hear the phone, no problem. So it's a good sleep, but it's not where I can't hear things going on, where I can't wake up if something's
Right.
going on. So,
Right. Or you don't feel drowsy in the morning, like
and you don't
you
feel
were on
drowsy in the
something.
morning. Yeah. Even when they wake me up, it
Yeah.
wakes me up at 2 o'clock to change. I don't feel drowsy or anything. So it does me really good.
Okay.
Hmm.
Good. This is so great. Julie, we so appreciate you. And
You
you guys,
bet.
I'll send that flyer out to you too. Yeah, this has been so good. Any other thing last minute, you guys? Anybody wants to ask or share? Okay. So we're good. Julie, thank you so much for taking time to come.
You
I
bet.
really appreciate it. It's
Yeah,
so
thanks for having
good,
me.
so good. So it's only 1 hour before you get home, right? I thought it was two.
What was that? 1 hour what?
Before you go to bed, no phone,
Oh,
no,
yeah,
computer.
1 to 2. 1 to 2. Yep.
1 to 2. Okay, I've been working on one, trying
That's
to
a good
just. The
a good
phone's not
start.
in my room anymore. Yeah, not in my room anymore. I'm gonna go to the setting too
I
tonight too.
did
To
I did
I
see a
didn't know
question
about
in the
that.
chat. I don't know if you answered or
Oh,
not, Julie, about magnesium, which type is the best sleep? Is
oh,
best for sleep. Sorry.
Magnesium? Yeah.
Yes.
mhm.
Oh, it's sitting right on my nightstand. I'm trying to remember because there's all the different ones, right? Citrate, like all that stuff.
Yeah.
I'll get that. I'll text that over to Maggie as well.
I
Margie.
I think it's
Okay.
glycinamate. I can't say
I
it
think you
today.
might be right. I'll look at my bottle that I got. I had Costco, or was it Costco? I can't remember, but I'll look at it and let you
Oh,
guys.
nice. Yeah.
Yeah.
Okay. Yay! Happy Friday, everybody.